everyone, welcome again to my channel. My name is Folakemi. How are you doing today? If this is your first time, thank you for stopping by. And to my returning subscribers, thank you so much. I appreciate you. Today I'll be talking about an infection that affects women mostly. It affects men, but women are at greater risk of having this kind of infection. And the infection is urinary tract infection, which is also known as UTI. I'll be talking about the causes, the treatment, and the preventive measures. What are UTI or urinary tract infection? These infections affect any parts of the urinary system. The urinary system is one of my favorite body system back in school then, because it's simple and straightforward. The urinary system contains of your two kidneys, the left and the right. People can live with one. Those that have issues with their kidney, they need to get dialysis to be able to filter waste products. The function of the kidney is very important. It helps you to clear out waste product out of your body. So the urinary system consists of the kidneys, left and right, which are two in number, the urethra, which is a tube that connects the two kidneys to the bladder. So the bladder is the third part, and the urethra is the last portion of the urinary system. So if there's an infection in any parts of this system, the person is said to have a UTI. The most common urinary tract infection is a bladder infection or urethra infection. The severe one is the one that affects the kidney. What are the common signs and symptoms of UTI? The first one is burning and pain. This is a question we ask patients each time we screen them. Like, do you have burning sensation or pain when you try to pee? If you have something like that, that's a sign of UTI. So burning, pain, frequent urination. When you try to pee, you feel like you did not empty your your bladder enough. So that's also a sign of UTI. The urine will smell so bad, foul odor smelling urine, and it will be concentrated. It will be dark color. Sometimes you can actually see blood in your urine, or the urine will be cloudy. Like, you will see a lot of particles in that urine. In older adults, especially in nursing home, one sign that usually tell the medical practitioner that these older adults is going through UTI is confusion. They become so confused. They fight. They just get up and do whatever. Then you will just know, like, this person is going through urinary tract infection. How can you treat it? First of all, you have to confirm that what you're going through is a UTI by giving a urine sample to, maybe when you go to your doctor, when you have those symptoms, you have to actually go to the doctor. Give the same sample and they will do a urine analysis. So they'll be able to confirm which kind of micro or bacteria you have in your urine. And the doctor will be able to prescribe a treatment. In the United States of America, you cannot just go to a pharmacy and say, I have burning sensation, can you give me antibiotics? No, you have to see a doctor for you to be able to get antibiotics for treatment. And the antibiotics they will give you would depend on the bacteria they find in your urine. Some, they're just like 3-day course, you're good. Some are 7 days, some are for 14 days, and severe one you can get like 21 days. So the main treatment of UTI is antibiotics, because it is mainly caused by bacteria. UTI affects women most because of the anatomy of the woman. The urethra in men is longer than in women, and this puts women at greater risk of having urinary tract infection. They always teach women, when you clean up yourself, when you wipe yourself, make sure you wipe from front to back, from your vagina area to your anal area. That is the way you should wipe, not from your anus to your vagina area. And this is because when you wipe from back to front, you can introduce bacteria from your poop into your reproductive system or into your urinary system. And this is why they do this teaching. You can prevent UTI by making sure you drink enough water. Make sure you drink water. I cannot overemphasize this. Water is good for you. Make sure you drink water to help you clean out your system. Also, for ladies, make sure the feminine product you're using is not something that can irritate you or introduce bacteria into your system. I hope this teaching will help you to recognize the signs and symptoms of infection and how you can prevent it. Thank you so much for watching. Till I see you another time, I remain your friend Folakemi. Bye.